4.7559.
Then we're going to take one coil at the same time so that if we start to record the problem, we can fix. My name is Dr. Hammed Ninolowo. I'm a vascular and interventional radiologist. My name of my practice is IR Doc Nigeria. My practice is primarily domiciled here at Euracare Multi-Specialty Hospital. This morning, what we're doing is something called a brain aneurysm pipeline stent placement and coiling at the same time. This will probably be the first one we've done both at the same time in Nigeria. And we've been doing brain aneurysm coilings and neurovascular interventions for nearly 3 years now. The nice thing is, we can readily treat a lot of patients with brain aneurysms or ruptured brain aneurysms in Nigeria now, which didn't occur before. The only option that was available for patients was surgery. But here we have a team of people that can help us with these patients and take care of these patients because these are very, very critical procedures that you have to have a lot of attention to detail because you're obviously in the brain and you can't take any wrong steps. We do a lot of pre-planning before we start the case and obviously stay a little prayer because each of these cases is basically a TikTok moment for us. But yes, we're about to go treat this woman and hopefully we should be done soon with success.
It's called menstruation.
515.
You have it?
Almost.
Yeah, 515.
Yeah, it's out now.
Now let's do the 620.
You know it.
Go ahead and open up the 620.
He has one. I say I've
What's that?
I get 3 by now. What do we have left in the strikers, by the way?
We have
Open this one.
4x8s.
Open this. What's the back end of it? So basically, this is a patient who's bled from an aneurysm and also has a closure of a right eye, something we call ptosis in medicine, and that's secondary to basically compression of something called a third cranial nerve. So basically, this is the aneurysm here, this is the normal vessel. So the reason this aneurysm is complicated is the fact that the neck of the aneurysm is quite wide. So typically we will just come in here and put in coils, but as you could imagine, if we put in coils in here, those coils will come out. So we needed to take an extra step through the procedure to put in something called a flow diverting stent. You can see that stent here, basically making this turn, right? And basically that stent, after we then put in that stent, we then put in a microcatheter in here so that we can then start to put in our coils. What you would see at the end is basically we have now opened the stent very nicely, right? We proved that, but you can still see that it's still flowing to the aneurysm. So we then go in there to basically occlude the aneurysm. And when we're done, this is the result. You can see that there's flow within the parent vessel here. And basically the aneurysm is now excluded from circulation and the aneurysm should be protected. This is a procedure we now do through a small access in the groin instead of opening a patient's brain in order to go find this, and hopefully she should wake up fine and get up to a good recovery after this.